Hello, hello. Good morning, everyone. Welcome to your first annual YSC Virtually Yours Summit. My name is Carolina Capellan, and I am a breast cancer thriver and a YSC face-to-face coordinator with the Fort Lauderdale chapter. I'm also part of the Breasty Girl Gang. We're so happy you're here, and I would like to take this opportunity to introduce to you Dr. Jaclyn. She is also a fellow breast cancer warrior, a board certified physician, and a holistic practitioner who's going to share with us some valuable information on how holistic practices can help us better navigate breast cancer pre, during, and post. Welcome, Ms. Jaclyn. The floor is yours.
Hi, thanks so much. This is my second session today. I'm already energized from the first one that I did. So looking forward to diving in. Let me
Yes.
see if I can go ahead and share screen. Let's see here. Are we all good to start a bit early?
What time is it? Oh, we did start a little early. Okay. What time is it?
I think we're good. We can have more time for questions if that's okay.
Okay. It's your, go for it, doctor.
All right, let's rock. So today's topic for my second session is holistic cancer care, the whole body approach to side effect relief. General disclaimer, this content of the presentation is for informational purposes only. It's not intended to be a substitute for professional medical advice to help diagnose you or a treatment. So important that you talk to your medical doctor regarding any of the information that's provided here that you're curious about. And I know that this disclaimer says medical cannabis treatment, but it was a typo. This was actually from my previous one. So disregard that last little bit. So a little bit about me. I am board certified in family medicine. I trained in functional medicine and I specialize in hormones. I'm licensed in a couple states, California and Florida. I'm also a medical marijuana qualified physician in the state of Florida, and I work at Parsley Health. Parsley Health is the largest holistic wellness practice in the country. We see patients in 48 states virtually and also locally in California and New York. And part of the practice that I work for is really honing in on the root cause of patient conditions, forming wellness partnerships so that you can learn about your health and also feel empowered. And I love that our team also has health coaching, where the health coaches can also provide additional information on how you're living, sleep, eat, movement, all the things when it comes to lifestyle, because those things are so important. And we are going to talk about some of those things today when it comes to managing side effects. So what is integrative and functional medicine? I've given you a pretty whole definition here about what that means. Integrative and functional medicine uses a patient-centered, holistic approach to wellness. So we're taking into consideration everything from even the time that you're born all the way up until wherever you are in your cancer journey. We're looking at your physiology, your mental health, your spiritual health, your emotional health, and social components. Think about how your life has changed over the course of time and how important it is to take all of that into consideration when you're thinking about your health and your own journey. And so integrative medicine really brings together lots of different modalities, lots of different tools in your toolbox when it comes to helping to support you on your cancer journey. So it's not just about medications only. It's about lifestyle. It's about supplementation. It's about nutrition. It's about the emotional and mental health component. So there is so much that encompasses this type of care. And when you think about the specialty of integrative oncology, this is a very, very specific honing in on those of us that have experienced cancer. And it does encompass mind, body, natural products, lifestyle modifications, all throughout different parts of a cancer treatment. And so the purpose of integrative oncology is to optimize your health, really support improving your quality of life, and helping to support these positive clinical outcomes that we're looking for across any part of where you are in that cancer journey. And it's so important that we feel empowered to be able to do things for ourselves and advocate for ourselves. So before you begin, these types of therapies should also be initiated with the knowledge of a treatment team, including your oncologist. And it's important that you discuss it openly with your oncologist. Complementary and integrative providers should also be aware of your diagnosis and treatment before they begin any additional treatment. So anything that's going to have to do with treating your condition, it's important that your whole care team is all aligned. And so they all feel like they're communicating with one another regarding what's best for your care. And there is a field of integrative oncology that is very specific. So you have traditional oncologists, and some of them are also well-versed and knowledgeable on integrative oncology.
Mm-hmm.
So managing symptoms holistically, since that's what we're here to talk about today. Some of the main symptoms, and as we know, there are so many more symptoms than this that comes out of the cancer journey, but here are some of the main ones that we're going to touch on. I have a bit of time to talk about the nuts and bolts, and then we will absolutely have additional time at the end to really dive in even more to answer your questions. So managing nausea. Chemotherapy-induced nausea and vomiting, it's typically treated with antiemetics. Antiemetics are medications that will help suppress that type of a response in the body. But there are also other treatments that have been helpful as well. I personally found acupuncture to be really helpful. And acupuncture, when you're focusing on the P6 point, everybody has P6 points, both on the inside of our wrists. So the acupressure point for P6 is located there. And you'll find that with acupuncture specific for managing nausea, this is a great location to apply pressure, and it does help relieve some of the nausea that we get from chemo. When I was going through chemotherapy, I actually found this last part here on the slide to be really helpful. Aromatherapy was so powerful for me. And I remember sitting in the room thinking, okay, there's a girl walking around and she's got these small little, she had like cotton pads, and she would put essential oils on the cotton pads. And I remember being like, oh no, I don't need that. That's not for me. And then
Yes.
as everything settles in and you're sitting there for a few hours, and I had a cold cap on my head, and then you're like, oh no, I need some help. I need all the help I can get. And I really found that the lemon was it was just, exactly what I needed to help distract my mind and really help to support me when I was feeling so nauseous during that time. So that's a really important one as well. Some people also like ginger. Ginger is great even in integrative and functional medicine for people that are experiencing nausea from other conditions, right? Not just chemotherapy. And the cool thing about ginger is you can do so much with it. You can actually make it into a tea. You could make it a cold brew if you needed to. You could use ginger lozenges. They make those specifically for nausea, so that's really helpful. And some providers also recommend higher doses of ginger, and it'll come in capsules. So, at least there's a few other things that you can consider here when it comes to managing nausea. Fatigue. I wish I could say that this is just something that you experience in the early stages of your cancer journey, but as all of us know, and as all of you know, that this is something that we experience all throughout our cancer journey. It's not just at the beginning, it happens all throughout the entire cancer journey. And so cancer-related fatigue is very specific. It's feeling exhausted, disproportionate to the levels of physical activity that you're doing, and they can be so debilitating. Think about, for those of us that have, been through that stage where I had a double mastectomy and I was so tired after my surgery. I was so tired after every single chemotherapy treatment. I just really needed to support my body in healing. I just needed rest. And I had to acknowledge and accept that some of this was the fatigue from my treatments, and my body just needed that extra support and time to recover. I really found acupuncture, again, for my post-treatment to be super helpful. Yoga has been helpful. And then energy conservation counseling. There's lots of strategies for really simplifying and organizing some of your daily tasks and helping you incorporate rest breaks, just so that you have, the simplified version of the things that you need to do. When you put things out, when you need to go to the bathroom, how far are you in proximity from going to the restroom? There's lots of little things that all of us have experienced where if you look back, you're trying to really conserve as much energy as possible, especially during such a difficult time early on in the cancer journey. Occupational therapy is also helpful for this as well. So when I think about managing fatigue, we have to recognize that our bodies are going through so much, but yet your body is also so incredibly resilient. And part of the side effects in the process here is just honoring that and saying, look, my body is experiencing this right now, and I'm going to get through this, and really creating that hope and that positive confidence in yourself, because you will get through it. Other things, I've talked about rest a lot, but in bold on this slide, restorative sleep is so, so important to the healing process for so many reasons. It's not just about cancer. I talk about this every day in the work that I do for patients that are coming to see me for all different types of chronic conditions. But sleep is so important because this is where all the magic happens. All of the restorative things happen when you sleep. Your neurotransmitters are improving when you sleep. Your hormones are improving when you sleep. Even your digestion, which is resting while you sleep. There's lots of things that are happening inside the body. And from an immune standpoint, let's think about melatonin. Melatonin is that sleep hormone that is so, so important for cancer. So if you think about it, the more that we can get really good, well-rested, restorative, good quality sleep, we're already fighting that battle. We're already supporting our own healing. Managing pain. If I can, I think about pain and how women and men experience it from a breast cancer standpoint. It even starts even at the point when you're diagnosed. When you're just getting diagnosed, you can experience pain there. I documented here, after surgery, after chemotherapy, radiation, and even after taking some of the medications that are suppressing our hormones. So for those of us that have experienced pain during your breast cancer treatment, you are not alone. Pain management, you have to think about where it's coming from, really understanding that. And then talking to your doctor more about the types of symptoms of pain that you're having. Sharp and shooting, exactly where? Is it at a specific location? Is it radiating somewhere? Is it so debilitating that you can barely move? And so all of these things are so important to assess. So you have to assess this. And there are so many opportunities to help support it. There are medications that are helpful, but then there are also non-pharmacologic modalities that are helpful as well. I found for managing pain, I had to try to distract myself from some of the pain. And after my double mastectomy, I really used gentle movement to be the most supportive there. That meant that I had a rebounder, a mini trampoline, and even just like the gentle bouncing on a trampoline was helpful for me. I used the wall climb and used the physical therapy that the doctors had recommended to help support getting circulation and movement post-surgery from my arms on both sides. And there is a Society for Oncology Massage. You can look them up. They do support safe delivery of specific kinds of massage, very gentle, to people who have been diagnosed with cancer. And on their site, they do have a lot of resources as well. Acupuncture also helpful for managing pain. I found topical preparations and creams to be really helpful as well. So, my support team had even combination. There were times when I, throughout my cancer journey, have used like a CBD balm. There were times when I had used a compounded topical cream that had different medications in it. Especially right after my double mastectomy, I did experience so much pain from the nerves that were cut. And so I had a lot of these sharp shooting pains that were stabbing me to the point where I could barely walk for some days. And applying the topicals were really, really soothing. They have ones that include muscle relaxants, numbing medications, anti-inflammatories, and they even make natural versions of that as well. So when you're thinking about pain management, we also have to assess it properly, so that you know exactly what you're going to describe and tell your care team and your doctor. And then think outside the box for some of these other ways to help support you. Brain fog and chemo brain is up next. So common. I have yet to find a breast cancer warrior who has raised their hand and said, I've never experienced brain fog or chemo brain on this journey. And it is such a wide array of the types of symptoms from a brain fog standpoint that you can experience. Sometimes it's the concentration, sometimes it's just the fatigue, sometimes it's the irritability and confusion. Sometimes, we have even more than that where the symptoms are so debilitating. And it's not just that we experience it after chemo. The surgery itself, right? Or surgeries for some of us, and even radiation can play a role in brain fog. Again, occupational therapy is helpful. So your care team, your oncologist team can recommend some of these things. And even some patients, tap into the advice of a neuropsychologist to help individualize your strategy to minimize the types of dysfunction that you can have from the side effects of treatment, whether that was chemo, surgery, radiation, and so on. Stress. I have a couple slides here on stress because stress is just so incredibly important. Anxiety and depression, a very, very big problem for breast cancer patients. And what I realized is that when you feel like you're alone and you have no one to talk to, it's so important that we reach out to a community that feels supportive and can acknowledge and listen and see you and hear you. And that's what I love about the Young Survival Coalition, finding a group of women and men who have all experienced this and who are going through the same thing at one stage of the journey or not. You develop this community where you really feel comfortable and confident to be able to talk about your own personal experience, because guess what? They are going through it as well, and they might be in a different stage. And so sharing your stories and sharing your experience, both positive and negative, it's so important. And I just wanted to put that plug in there. I love that this community can do that. There are therapists that are very specific to cancer warriors. So they have had additional education in dealing with patients that have been diagnosed with cancer and are at different stages on their cancer journey. So if you're able to find the therapist as a resource, who is specifically geared in this, that is so important to do so. I love a lot of the mindfulness-based stress reduction techniques. They have been researched. There's different types of programs that are offered for women and men who've experienced this. And meditation, very helpful. Yoga can be helpful. I like the last part here about guided imagery, positive guided sentences, journaling, soothing music that brings you joy. Breath work is so important. And whatever way that you manage your stress to help support relaxation, that is of utmost importance throughout the entire journey, from the time that you're diagnosed all the way as you are progressing on from years. It's just so important that you manage your stress. The other reason why I think stress is so important amongst all of these is that it does have this trickle-down effect to affect lots of different physiologic things that are happening in your body. So it's not just that this is stress from side effects of treatment, but it can also create problems with your gut and your digestion. It affects your mental health. It can affect the way that your hormones are working. It can affect your own physiology. So it's important to acknowledge that, and having really good stress management tools and techniques, it's so important to try to really incorporate this on a consistent basis every single day along your cancer journey. So just some next steps. Again, talk to your doctor about using integrative and complementary medicine before, during, and after your treatment course. Talk with your oncologist and your whole care team to talk about which types of things are right for you. They might recommend acupuncture. Maybe they want you to see a massage therapist who is very specific, to cancer patients. Maybe they have a compound that works so well and that can help support topical application to areas of intense pain, to help support muscle relief and just on-the-spot treatment. Again, so important to manage your stress. Of all of these, that is one overlapping layer to the entire cancer journey is stress management. So I cannot stress enough how important that is. If you have additional questions after the next little bit here, where we're going to have some time for a Q&A, this is my personal email address. I give this out during all of my free webinars. I think it is so important for us to connect if you feel the need to do so. And so this is my email. You can put YSC Summit 2021 as the subject. And if you're interested in learning more about me, the type of medicine that I practice, Parsley Health, the company that I work for, or you're just interested in getting to know another fellow breast cancer warrior, this is my social media handle on Instagram. And I am all done. I'm going to go ahead and stop sharing so we can get into some Q&A here, Carolina.
That was wonderful. Thank you so much for your time. And we do have some good questions, some interesting questions. So I'm going to go down the list. Brain fog, Dr. Jaclyn, how would you address that? What's the best way to control brain fog? Some of us still have it after 3 years. What's the best approach to that?
After 3 years. So when we talk about brain fog in functional medicine at the practice that I work for, you think about brain inflammation, right? And if the brain is inflamed, if we're having inflammation that's there, it can affect the way that our neurotransmitters are working in the brain. And that trickles down and affects different components of mental health. So what I think is most important for brain is that we are exercising our brain. We are utilizing it as much as possible. We are talking to therapists, mental health professionals, psychiatrists on ways to sharpen our skills. And for some, even acknowledging that it's even a problem. For some of us, we're like, oh, I don't think that's it. I'm not having any side effects from my treatment. I'm feeling good physically. But then we haven't even acknowledged that we're forgetting things and we might be slipping up. And maybe we're, having some short-term memory issues. And maybe we have changes in our personality that are just not clear. So it's so important to really talk to a health professional that has specific care in mental health. I thought my psychologist was so crucial to my care so that I could really explain some of these examples of where I was noticing the brain fog, and they could help me find treatment strategies that were unique.
Perfect. Thank you so much. We also have somebody inquiring on speech therapy, how important speech therapy is and how it helps with your memory and concentration. Can you share a little bit on that with us?
Yeah, so speech therapy is wonderful as a resource. Again, doing a self-assessment and acknowledging, when and if that is an issue for you. Occupational therapists and oncologists do have a lot of resources for patients that are dealing with this. And what I'd say is that we have to raise our hand, and you have to say, as a patient, advocate for yourself. I am having difficulties with X. I am really suffering from consistent issues with Y, so that they are clear and you've communicated what you need support with.
Okay, thank you so much. And acupuncture, you mentioned that in your presentation. Acupuncture is a great tool to helping heal. Can you share what's your best methodology to find an acupuncturist? Is there a certain degree, or what should we look when looking for an acupuncturist?
I had tried a couple different acupuncturists, and for me, energetically, I had to have a conversation with them first so that I could understand their philosophy behind the care. I gave them a little bit of info about me. I told them that I was looking for what exactly I was looking for. And I had actually used acupuncture early on, right after my double mastectomy. I found that consistency was key. And what I loved about it was I just had a great relationship with somebody who I felt really confident in her skills. And I felt that she was, her philosophy on how she practiced it was amazing. And I think that that's what's best is, in order to find one, you have to seek out those resources, ask if you can have a conversation first so that you can get to know them a bit better, and then, move forward with a treatment. There's so many different types of acupuncture treatments. So finding a professional and just really talking to them and having that open conversation, I think that will intuitively help you decide if this is the right person to help support you.
Correct. Like just feeling comfortable. You have to be able to walk there and be, okay, I can be my best self, and this person is going to help me. You have to definitely feel comfortable.
Yes. And I will admit, there were times where I was crying in my sessions because I was just full of so much emotion from the experience. I had used a lot of acupuncture early on, literally within weeks after my double mastectomy. And I remember that letting those emotions out and helping to support breath work and concentration, while I was getting those treatments, it was so powerful for me. So I just want to advocate for that.
Yes, definitely. Thank you. I also have, let's see what we have. We have a lot of great questions. Lymphedema, do you have any modality, any recommendations for lymphedema treatment,
Yes.
prevention that you can
There
share?
are specialists for lymphedema that you can see that have specific training in this. It also depends on the degree of lymphedema, exactly how far along we are, how far it's progressed. But finding resources for that, I'm sure that this is something that we can compile with the Young Survival Coalition, some trusted resources for lymphedema support. Maybe afterwards we can come up with something to summarize some of the points here.
Yes, I love that. Let's see what else we have. What about addressing neuropathy without medication? That's an interesting one.
Yeah.
What's your take on that, Dr.
Yeah.
Jaclyn?
So remember that your body is very resilient and it can support its own healing, right? And when it comes to neuropathy, some of that sensation from nerve standpoint with pains, we have to talk to a professional who understands the mechanisms of pain, because sometimes it's not just about where it's concentrated, whether that's hands, feet. In my case, I felt like it was a sharp shooting, radiating pain from my shoulder blades down to my fingers. But helping with gentle movement and circulation has always been really helpful there. There are natural herbs and also natural components that are helpful. There's certain vitamins that also help with neuropathy. So finding an integrative doctor or a doctor who practices functional medicine can really help to support some of these non-medication modalities that we're looking for. Same thing with lymphedema. If you think about lymph, collecting in a certain area, helping to support better blood flow and circulation throughout the body, there are natural things that can be helpful for that as well. But it's not just a free-for-all of listing those out. We have to think about you and your story and what's going to be unique to your care. And that's why it's important to seek a healthcare provider that really understands that component.
Yes. Okay, so we're almost out of time. I do want to say, let's see what we have here. We do have an important question, and this is medication, antidepressants, and hormonal treatment replacements. Anything else that you can share before we shut down with reference to that? Depression, hormonal replacements, and antidepressants. What can you tell us?
Yeah, well, with antidepressants, there's natural ways to support it as well. So we have to consider that. Medication is just one tool of many tools in your toolbox to help support you. And you have to acknowledge that as well. So for some patients, depending on the degree and severity of their issues, medications might be the best choice right then. But for other people, medication might not be the best choice at that moment, because we're also thinking about the side effects from those. And yes, there are medications like antidepressants that do have side effects as well. And so talking to your doctor about having the different options for natural ways to support you, as well as medications, and understanding that, find a healthcare team who really understands that, because there are solutions outside the box of medication therapy, as I've kind of presented today.
Okay. Well, I am so thankful to have you on here with us, with our YSC community. We would like to thank you for your time, all the information. We are going to go ahead. If you have any specific or personal questions, we'll have a personal Q&A. You can also seek Dr. Jaclyn. Her information will be provided to you, her handle. And if there are any other questions, please feel free to drop a line. Thank you so much for taking the time to take care of yourself. Thank you, Dr. Jaclyn, for your time, and enjoy the rest of your YSC Summit, everyone. Be well.
Bye, everyone.
Thank you. Goodbye.